Welcome back. A new study by Montefiore Einstein finds that the majority of cancer patients with COVID-19 have similar immune responses to people without cancer. And now specialists are saying that these patients should be prioritized for COVID-19 vaccinations. Joining us now to share these findings and more is Montefiore Hematology Oncology Fellow, Dr. Astha Thakkar. Welcome, doctor. Thank you so much for joining us today.
Thank you for having me.
Of course. So first, Montefiore Einstein recently published a new study finding that most people with cancer should be prioritized for COVID-19 vaccinations. Can you tell us about this study and your findings?
Of course. So, our health system, Montefiore Einstein, was one of the first places in New York City which was hit with the first surge of COVID-19 cases back in spring of 2020. And we were seeing a lot of patients who were coming in with the COVID-19 disease. And as an oncology fellow in training, myself and my colleagues, we were wondering how our patients are going to respond to this virus, because many of them get immunosuppressive therapy as part of their cancer treatment. So we wanted to study the immune response after COVID-19 infection in this patient population. And so we collected data on 261 patients with cancer who underwent antibody testing at Montefiore for COVID-19, and we found that majority, which is like 92% of our patients, were able to develop an antibody response to COVID-19, which is very comparable to the general population, i.e. someone without cancer. So that is, the major finding from our study.
Wow.
And sorry.
No, it's okay. So Dr. New York is currently vaccinating phase 1A and phase 1B groups. As we know, people with comorbidities over the age of 16 qualify under this phase in particular. Are COVID-19 vaccines currently available for all patients with any type of cancer? Is that something that's happening now?
That is correct. So any patient, as you said, above the age of 16 who has a current or previous diagnosis of cancer. So even if someone has been treated for a cancer 5 years ago, 10 years ago, they qualify to get the COVID-19 vaccine. And the results from our study, support that patients with cancer are able to develop a very good antibody response to the infection. So we are hopeful that with vaccination, we would see similar responses.
Got it. And I think something floating around is a concern, doctor, that some cancer patients currently undergoing treatment should or should not avoid getting the vaccine. What is the consensus here? Should people undergoing cancer treatments avoid the vaccine, or is that not going to be an issue?
That's a great question. And to answer this, we specifically looked at prior cancer therapies and their association with antibody responses in our patient population in our study. And we found that while majority of the solid tumor patients, like for example, breast cancer or lung cancer or prostate cancer, those patients had about a 95% antibody positivity rate. So 95% of them developed antibodies. However, in the subgroup of patients with blood cancers or hematologic malignancies like leukemias, lymphomas, or multiple myeloma, they had a lower antibody production rate, which was about 82%. So we identified this specific group of cancers which had a lower seroconversion, as we call, of the COVID antibodies. And specifically, we found that patients who had received anti-CD20 antibody treatment or stem cell transplant had a lower rate of positive antibody as well. So while it appears, the majority of majority of the patients who were receiving anti-cancer therapies were able to mount a good immune response, delaying vaccination or delaying treatment is something we think still should be very individualized to each patient and be discussed with their oncologist about when they make a treatment plan.
Got it, doctor. Thank you so much for clarifying that. So it's definitely depending on the type of cancer that you've had to fight and the type of treatments that you've undergone, correct, doctor? Just to emphasize that.
Correct. Yes. Yes.
Got it. Another thing that we know is that 3 COVID-19 vaccinations have received emergency use authorization from the U.S. Food and Drug Administration. As we know, the Pfizer, Moderna, and Johnson & Johnson are the 3 types of vaccines. Should people with cancer get a specific COVID-19 vaccine? Is one preferred over the other?
In all of these 3 vaccine trials, patients with cancer were excluded. So we don't have any direct comparative data. But as health officials and experts say, you should get the first vaccine you can. So I think in terms of their efficacy, they vary between like 70 to 95% based on which brand. So but we still recommend that you should get a vaccine, and we unfortunately don't have any direct post-vaccine data yet.
Got it. Okay. I think we spoke a little bit about this topic, but are COVID-19 vaccine efficacy rates affected by any cancer treatments as well?
Well, again, there is no direct data because as vaccinations are just being rolled out, we will continue to learn more as more and more patients get vaccinated. But it seems that from the infection, like immune response from the infection was affected by patients who received, say, anti-CD20 antibody therapy or stem cell transplant. In these particular patient populations, there was a lower rate of positive antibody lower rate of positive antibodies. Okay. Patients who had received endocrine therapy, on the other hand, had a very high rate of positive antibodies. And patients who had received immunotherapy in our study, had 100% positive antibody rate. So while we will still continue to learn more about vaccines and their efficacy in this particular patient population. What our study tells us is that majority of our patients post-infection were able to mount a good immune response to the infection. And we are hoping that this data will extrapolate into a post-vaccine immune response as well.
Got it. Do we know anything about projected safety of the COVID-19 vaccine for cancer patients, doctor? Anything that you can share in that regard? A lot of people are worried about getting it, depending on their immune response as well.
Right. Well, it seemed, again, like patients with cancer were excluded from these clinical trials, so it's very difficult to make direct conclusions. However, this is something we are aiming to study in future. So we are trying to collect data and study the adverse effects of patients who are specifically going to get immunotherapy and the COVID-19 vaccine, and to see if they experience any serious side effects.
Got it. Doctor, something we spoke about earlier with Montefiore was about monoclonal antibodies. Is that something that cancer patients qualify for at this point, besides the vaccine?
Yes. Monoclonal antibodies are, for mild infection not requiring hospitalization. Our patients do qualify for that, and we are able to administer it to our patients at Montefiore.
Got it. Thank you so much for your time. Before we go, doctor, how can people get in touch with Montefiore and find out more and inquire about just getting the COVID-19 vaccine moving forward?
Of course. So the best way to get in touch with Montefiore is through the website, www.montefiore.org, or our Twitter handle @MontefioreNYC, or I could call the phone number 1-8444-442819 and receive information about vaccination at Montefiore.
Got it. One more time. Just one more thing before we go also, just about prevention and the importance of preventative care and attending these, your appointments with your doctors, especially when it comes to oncology and following up with cancer treatments. Could you just share a few messages of encouragement for patients?
Of course. Yeah, so we observed in our study, actually, we looked at this. We observed that patients who had solid cancers, as I said, breast, lung, prostate, or colon cancer, they shed the virus. If someone had tested positive for COVID-19, they remained positive for a mean of 30 days. And patients who had blood cancers like leukemias and lymphomas, if they had tested positive for COVID-19, their PCR remained positive for like 60 days. So in addition to identifying patients who had high antibody response rates with some caveats and some low antibody response groups, we also identified that patients with hematologic malignancies tend to shed the virus for a significantly longer period of time. So this also tells us that even though vaccinations are being rolled out, we need to mask up and take all precautions, wash our hands frequently to keep preventing the spread of COVID-19. And this collectively, our findings, we are able to conclude that specifically in patients with blood cancers or hematologic malignancies, they require like very close surveillance and follow-up to make sure that, say, after an infection, if they're able to develop antibodies, and how long they are remaining positive for the SARS-CoV-2 virus, to be able to protect other members of the community.
Dr. Astha Thakkar is a Montefiore Hematology Oncology Fellow. Thank you so much for joining us again today. We'll be right back here on Open
Thank you.